When Chris Turiyamreba first came to KH Dental Clinic, he wanted to have his tooth extracted, but the dentist advised him to carry out a procedure known as root canal, to which he consented.
I had to come in once a week, 3 times.
He was worried over defaulting on the debts for treatment.
I'm an accountant and almost I work 18 hours a day, so I find myself so busy to even remind myself that I have to see a dentist.
He was however surprised to receive a text message from the clinic reminding him of his first appointment until his tooth was fixed.
What used to drive me to come in was actually the reminders. I don't remind myself.
Since then, Chris has an attachment to this clinic. A tech-savvy creative team is behind this customer satisfaction, which is aimed at improving service delivery and communication amongst healthcare providers and their patients. Kakpema Yolpala, the founder and CEO of Access Mobile, which started in Uganda, says his tech company is focused on improving healthcare in the country, and their latest app, the Clinic Communicator, will leverage this.
Our concept is what we call like a patient relationship management. So we see a lot of people want to have a better experience with their hospital.
The app in question is easy to use once one logs in and accesses different detailed sections, including calendar and patient numbers. John Luberanga takes us through a brief of what's done when different practitioners are introduced to it.
You can send an individual SMS. I'll just say, how are you feeling today? SMS. It details the communication from the facility. So you can as well do a bulk SMS, like you can send an SMS to all the patients. You can also do a bulk SMS to all the practitioners.
For Dr. Esther Lukwago, a dentist with KH Dental Clinic where Chris comes for dental care, this has helped to improve the bond between the client and the service provider. She says her first interaction with the app was in October 2014 at a scientific conference where Access Mobile made a presentation.
We don't just come in and take your temperature, your blood pressure. We perform a procedure, and these procedures take time. Different procedures take different amounts of time. So it's very helpful, not just to the doctor, but to the patient, to schedule enough time for each procedure.
She says patients are given first priority.
We had been having troubles before. When a clinic is new and it's not busy, you can deal with it. You're happy when anybody walks in at any time. But as you get busier, you realize that you need something in place, a sort of system in place to help you schedule your appointments.
She finds this a bonus to the electronic medical record system in place. To her, Clinic Communicator has been the missing link. The recall rates have improved, and she says they got more than what they bargained for.
They're able to help us with our medication reminders to our clients. This we didn't see coming, but it was a good surprise. We do, of course, dispense medications. And worldwide, most individuals, when the initial discomfort is gone, they tend to forget the rest of the prescription.
We see more and more people having things like diabetes or hypertension. And so those type of health issues require the doctor to be in touch with the patients more frequently.
And the calendar on the app makes all this effortless. Jan Mukulu, the General Manager Access Mobile Uganda, says with the increasing number of mobile phone ownership to the grassroots, Clinic Communicator stands to the leverage on this. About 10 million Ugandans' own phones have integrated them as part of their everyday life. This has made health professionals, including the Ministry of Health, to use this technology for health promotion.
The facilities are spending less money because all the patient communication used to happen by phone calls, which was pretty much expensive. And the shop, because when you miss a call, you don't exactly know who called, say if it was a landline. If you receive a message later, you will still be happy that you received it.
For a busy person like Chris, there's no time to talk on phone.
So I can just type a word, yes, I'll be in, and they get my reply.
What we're doing is we're designing a system that is fully catered for patient relationship management for hospitals.
And the beauty about the Clinic Communicator is that it can be used to arrange patients according to the diseases. Access Mobile is a member of the Uganda Healthcare Federation, an advocate for private healthcare providers.
We want to have more and more partners. So, for example, maternal child health is a really important issue here in Uganda. So you can imagine the same type of platform can be used to remind mothers to take their kids for immunizations, and it doesn't matter where that person is in the country.
And our latest association is the Uganda Private Midwives Association. So we see this bringing technology down to the grassroots.
The app has much potential and they are set on selling it to the Ministry of Health so that it can be used in government hospitals, which are ever crowded with long queues. They want to discard of the paper system too in hospitals. Since 2013, Microsoft has partnered with them and they were one of 5 companies in Africa to receive its Innovation Award in 2014. With Clinic Communicator, a patient can text back.
I don't know why, but whenever I send, it's free of charge.
He's on UTL network, which made it free for the patients. Others like MTN also charge fair fees, ranging between 50 and 100 shillings.
It's actually the healthcare provider that pays for our system.
Dr. Esther says for its efficiency, it's worth the modest cost.
Now the clients, the few who've given us feedback, tell you, oh, by the way, it was nice that you reminded me because I'd actually forgotten. Or it's just nice to know that you people remember us even after we've left the practice.
And what I loved, another thing that I loved, they sent me a message telling me that I'll be reminded every year when to come in for a checkup. They keep me in there that I shouldn't die, actually. You know, a tooth can kill you. Yeah, so.
Chris says the innovation will go a long way in improving treatment.
And I don't think maybe I'll ever leave the clinic now. Yeah.
So on the one hand, while it sounds maybe like it's so straightforward, sometimes it's about the most straightforward innovations that can make people's lives different and improve people's situation.
It's such innovations that will likely change the image of an ailing healthcare system in this country. Florence Naluyimba, NTV.